Ladies and gentlemen, welcome to MedSynapse. I'm your host, Dr. Nigar, and today we have a very important topic to discuss: obesity as a chronic disease. As we know, obesity affects millions worldwide and demands our attention. Joining us to discuss on this important topic is the esteemed expert, Dr. Shaza Mohamed, a renowned family medicine specialist and respiratory medicine expert. With extensive experience, including clinical advisory roles and a master's degree from the University of South Wales, Dr. Shaza is a distinguished member of prestigious medical associations and serves as an adjunct faculty at Sharjah University Hospital. Welcome, Doctor.
Well, thank you. Thank you for inviting me on this platform.
Thank you so much for joining us today. Today, we will be covering three important sections: understanding obesity as a chronic disease, patient-centric approaches and pharmacological treatments, and maintaining long-term success, and some inspiring stories. Let's begin with our first question. Dr. Shaza, recognizing obesity as a chronic disease can really transform patient care. How do you perceive this shift's impact on healthcare?
So when we say that obesity is a chronic disease, and we're giving it chronic disease, that's how we put it, because the shifts are wholly management from short term to really focus on weight loss, to more comprehensive long-term focus on health outcomes, and it helps us also to provide to the patient long-term approach. So not just weight loss is our aim, also the overall health impact or overall health outcome of management. The chronic disease is very important because it will change our mindset and the patient mindset, and our approach will definitely. So by adopting a chronic disease perspective, helps us to provide more comprehensive, patient-centered, and adaptable to the unique needs of each individual and each patient. Because as we know, obesity is a complex disease, and it has many factors. It's a multifactorial disease, differs from one person to another, because we have many aspects to it, whether it is diabetic, whether it's behavior, or when we are dealing with it, looking at it as chronic, helps us to approach or to address all the factors, if all of them are present, or any of them. And this will also help us to improve the multidisciplinary, which can be doctors or healthcare professionals, exercise specialists, psychologists, or social workers. And again, this will help us to plan or provide a very individualized plan to the patient. And this also will help us not to our utmost or our near weight loss, but also to prevent risk factors coming from.
Treating obesity as a chronic disease differs significantly from addressing regular conditions. What's different in treating obesity as a chronic disease compared to a regular condition?
So, as I mentioned, that it's a complex, and we treat it as a chronic disease, means we need to put on a long-term approach. So we are not just going to go and have a quick fix, or like acute, we give the medicine and they're immediately. No, it's a very long approach. It's a long process. We have a lot of things involved with us. And this disease or obesity is a very complex disease. So, as we said, it is influenced by genetics, by environment. It's also influenced by biologics, hormones, many factors that have impact on it. So it's not a very straightforward condition. So when we have this in mind, and we know it's a long term, so it's very, it differs when we address it. So we have an emphasis on lifestyle changes. And I know that in all chronic diseases, we do exercise and lifestyle, but here this is the cornerstone. So we have to have changes in our lifestyle concerning dietary, physical activity, and even uh, psychological, where we have seen that stress can have an impact on our eating habits, right? So these are factors that can affect treatment also by setting realistic goals. So we don't say by a month we will do this. No, we talk to the patient, we have a conversation. This conversation helps us, after of course assessing them or assessing the patient, helps us to set together a realistic goal so we don't give ourselves very high hopes and then we feel so sad when we don't reach them. Again, we keep in mind that it's important to understand that relapse or setbacks is something that we can experience in this condition in dealing and approaching to obesity. These are a few things that could be affected by them.
Understanding the challenges faced by healthcare practitioners in accepting obesity as a chronic disease is key. Now, what challenges do practitioners face in accepting obesity as a chronic disease? And can you share advice to overcome this?
We do face many challenges just in terms of stigma and bias, because as healthcare professionals, they themselves make those bias or stigmatizing, right? So how to overcome that is by training, by educating healthcare professionals. Because as we would train when we're studying, we're not given every aspect of obesity. You know? We do not understand that as many as factorial chronic disease, so we can judge, unfortunately, patients that this is their choice. This is their practice that has led them to this, when it is not entirely the same. We can sometimes also can find some challenges in achieving the weight loss we've been aiming to, and this will help us feel frustrated easily. But when we set realistic goals, we do not get this frustrated easily. Neither the healthcare professional nor the patient, because when we have this openness and discussion and removing the stigma from the patient, from the doctor, it will be very easy to create this environment and discuss and to address his fears and the doctor's as well. Also, another challenge is time constraint, that it's a multifactorial disease and it has multiple approach. So it can take longer than usual to assess and manage. So this can, in a busy clinic or a busy clinical setting, be a bit difficult. But if we have multidisciplinary, we have time goals that are really clear, I think this will improve the time constraint that one has this goal and has discussion about it. Then this can another challenge could be changing mindset. That people need to shift from just focusing on weight loss, focusing on health outcomes. Preventing risks of obesity would be our main concern. This is another challenge that we face, because we can tell the patient that we're not just going to improve quality of life, we're going to reduce risk. And discussing the key goals with the community, this is how we can challenge the mentioned case. There are many challenges that can go on and on. The commonest
Explaining obesity as a chronic disease to patients is also important. How do you explain this to your patients effectively?
So it is as important as you mentioned. And we need to take the example, the safe space. This is where you talk and where you can discuss, address your concerns, your fears. Because some patients might face judgment, might stigmatize. This will make them not very welcome consultation. So choosing a supportive environment will be step one. And then empathize. Explain to the patient that I understand that this is not a choice, it's a disease, chronic disease takes a long period of time to achieve results, and it has many factors: genetics, psychological background, biological background, environment. So when we reach this understanding, we are getting closer to goal or the goal we are aiming at. When I'm discussing with the patient, I make sure that in plain language, try to avoid medical jargons. It's very simple and very understandable and approachable. You can also try to explain to them, like when the chronic, like other chronic parallel with other diseases like diabetes, like hypertension, explain that it requires a longer period and it requires follow-up and it requires like long-term health concerns and it requires a comprehensive. We also highlight complex factors like explaining how it is influenced by various factors, this as well, and discuss the health implications of obesity. So we all understand that obesity has risk factors. This needs to be conveyed and explained to the patient. And it can be like can cause cardiovascular disease, and it's a risk factor. It's a risk factor to diabetes. It's a risk factor to joint pain or joint problems. Addressing obesity, managing it, will help us prevent the implications, the risk, the consequences that happen. Also emphasize lifelong approach that obesity has a long life-term approach, and as diabetes is required a continuous monitoring to check that the blood sugar level is controlled, so does obesity requires a long life-term approach. Lifestyle modification, I mentioned, is important, and it's changing the lifestyle and not like eating the diets short period of time, then stop and then we go back. It's changing the lifestyle for the good on the long term. And then the treatment team that the patient needs to meet not just the doctor, not just that, but also maybe psychologists if they have emotional. So these are the steps that I take to address the problems. And I mentioned earlier, setting realistic expectations or goals is we addressing the stigma, providing resources to the patient, giving them complex topics to read or resources to read from, like online or published paper. So, and the follow-up, the scheduling follow-up is and I emphasize really the importance main thing.
Dr. Shaza, have you personally witnessed in your consultations whether patients respond better when discussing obesity as a chronic disease?
As a matter of fact, yes, because when we are doing discussion, respecting patient will discuss to respect what he has gone through, what he might have failed, if he has failed, explaining that it's not as he always thought it's his fault, because he's making wrong choices, practicing wrong practices, it's entirely totally his problem. When we do that and the patient understands that it's going to take time, it's not a quick fix, it's not just quick progress that we are aiming at, their response, their willingness, which is most important, will to go through that is very important. We understand it and that lapses and out. Yes, I.
Long-term management of obesity is the goal. What can healthcare practitioners do to ensure that obesity becomes a long-term management rather than short-term?
What we can do is first involving the patient, involving the patient in this conversation, and having resources to be able to have a multidisciplinary team, to have a specific clinic that has assigned time and for the consultation specifically for patients, keeping in mind the doctors, having resources to a dietitian, psychologist, to help provide this. And the medication, if you need to go through it, the willingness of the patient, the fact that all of us and that is what that needs to be addressed is very important. This helps to provide or to change the mindset from short-term to long-term approach. Setting realistic goals is very important. Understanding reduction setbacks and explaining it to the patient is very important as well. To have a team who understands that, to educate and train doctors, likely on why
The approach to pharmacological treatment for obesity may definitely vary by region. How does it differ in the Middle East, particularly in the UAE, and what medications are commonly prescribed?
So, in the UAE and Middle East, they actually align with international guidelines. So, I don't think there will be any difference. We always start with lifestyle modification, the assessment that we will do in the beginning to understand why we are having and individualize the plan and modify the lifestyle, improve diet, emphasize physical activity, and then we move to medication. So there are medications that are commonly used, like orlistat, which works or reduces the absorption of dietary fat. We move also to the combination of phenethylamine and sulfonamide, and then the next medication is combined with the lactose, which also affects the. These are not very commonly used as they were in the past. There's the liver glutide that has been entered as a medication for diabetes, and after a while, it is no effect on weight loss. And in the UAE, it is the only weight loss approved medication. There are many others that they are not officially yet approved as weight loss medications, but they are widely used as weight loss medications like semaglutide, the famous drug, I can say, but they are up now medications for diabetes, for the treatment of diabetes, but they have the need for weight loss for their impact on weight loss. The results are really remarkable. These are the ones that I can tell you. I have made we use liraglutide, we use semaglutide, and risdiplam as weight loss medications more than just diabetes.
Now, preventing weight regain is also very crucial. What strategies do you recommend to avoid weight gain after effective weight reduction for long term?
So, I mentioned earlier that setbacks are acceptable. So, when they're acceptable, we increase the frustration rate, right? We set realistic goals. When we reach the goals, we focus on lifestyle change. When we know that the lifestyle changes for long, is not just for a short period of time and then we'll get back. This would help us to maintain the goal or maintain the weight loss. Also regular physical activity. For a short period of time, then we reach people aiming or wanting. Mindful eating is important. To regularly monitor weight is it's not the entirety, but it's also important to track our progress. But I'm not asking people to become obsessive, okay? But this is a way of monitoring. Balanced diet, portion control, and have regular meals and set points, and to avoid uh, removing or deleting a meal altogether to maintain metabolism will help us. Also, staying hydrated is important. Drinking enough water during the day, getting enough sleep helps our metabolism as well, helps avoid us from overeating. And to understand ourselves, to have a stress management strategy, because emotional eating is something that can lead to or weight gain, and social support. Besides the doctor's support, to have a social support that runs the patient, to provide them support he needs, feels that that he's not encouraged to continue the healthy lifestyle that the doctor earlier. Regular check-ins with the doctor, regular follow-ups to have a say or a look at if we have achieved this thinking, are we having a setback, or plan and prepare our meals with others to avoid over or long cycle. And celebrate non-scale victories, like if I had high blood pressure and that was improved from improving lifestyle or from losing weight, we need to celebrate. Again, as I said, to accept that you don't accept setback. By changing the mindset to a long-term mindset, track my progress. It's all I can say to help maintain whatever gains we made, whether it is scale gains that weight loss or over or off scale.
Lastly, Dr. Shaza, can you share any success journeys of your patients who improved their health by treating obesity as a chronic disease?
I can, but can I read it because I cannot remember all the details?
Sure, of course, of course,
So I
of course.
had a patient, I will not disclose her name, and she was struggling for her entire almost adult life. So she had tried various diets, weight loss programs where she would lose weight and then come back again, like the yo-yo diet. So she had developed several relative issues like high blood pressure and pre-diabetes. So after many years of frustration, I had to approach her and she met me and I explained why I suffered. And that it is a chronic disease. You have a lot of patients need her and set the goals that you think you can, and slowly and in small steps changing lifestyle. So we got a registered dietitian for her and a psychologist for her, because whenever she gets stressed, whenever she suffers from anxiety or depression, she will have emotional eating, will have doubts of it, not helping her to lose weight, maintain interest. So we had a treatment plan. We personalized the nutrition, following with the guidance of the dietitian, and she adopted a balanced, sustainable plan. And then she learned about portion control and the importance of nutrient-dense food. Then we moved to regular exercise, and she gradually incorporated physical activity very soon. Where she started short walks, that has progressed to more structured workouts, which she has joined later on. We also adapted behaviorist strategies where we had her work with psychologists to address her emotional eating, behavioral These will help us as well to control and coping mechanism, support and accountability, and regular monitoring. All of this helped her to achieve the results that we have been aiming at, which were very realistic. And we managed to control her blood pressure without getting to have carb medication, which is very resistant to even medicine. And we achieved a good blood pressure and maintained good blood pressure within the normal levels by lifestyle, by helping her lose weight. We are still working on that, but we have achieved weight loss. We have a lower blood pressure.
Thank you so much, Dr. Shaza. Your success story shows the power of a chronic disease perspective. Thank you so much for your time and expertise and for contributing on this important topic today.
Thank you for having me. I really enjoyed it.
Thank you so much. I believe that this will benefit our listeners and the broader healthcare community. And a big thank you for our listeners for tuning in. This podcast is presented by MedSynapse, a platform facilitating global connections, collaboration, and learning among medical professionals. Join us on MedSynapse to interact with medical experts, and don't forget to subscribe, like, and register on our website to stay updated with the most updated topics. Until we meet again, goodbye.